Dr. Shetty, how do we reduce coro anxiety, sir?
I think, Shashank, as you know, we need to first see to it that the facts are in place and people know the facts. Now, what happens is when they chew the facts excessively and they ruminate over the secondary questions, the anxiety increases. So, if the secondary questions come up, they should ask a professional, they should ask a family doctor, but a reliable source. And I think that will also help them to reduce anxiety. At the same time, black humor with friends. माझी फाटते छायला आपलं काय होणार. I think that is very important. Let's ask every person in the city of Bombay and the country who are watching this video. Don't talk through your head all the time. Talk through your heart also, and then the anxiety goes down. And another way to reduce anxiety is to share it with your bosom friends, and also not act as if you're the macho man in the house. Share it with your spouse, your lover, or your partner. Hug her and say, "Salam bari patti hai," and then it goes down. So, to summarize, facts, answers to questions, managing fears. Exercise also dissolves fears, tears, and anger. And if your building gym is not working, do some push-ups, some Surya Namaskars, some sit-ups, or even spot jogging. I think these are the best ways to handle your anxiety. So many also prescribe yoga, mindfulness, allowing yourself quiet time, watching the grass if you're lucky, looking at the sunshine if you're lucky. So whatever works for you. Shashank, if you're aware, most of us have our own mind shifters and our mood lifters, which we have used across time. People who have been singing for a long time have stopped singing. People who have been painting for a long time, they have stopped painting. I think, do you agree with me that it's time that they use their old mood shifters and old mood lifters?
I completely agree. I think you need to rewire yourself, engage in your old hobbies, talk to friends and family, be cheerful and positive, be absolutely energized, but be extremely positive. It's also an ideal rest time and siesta time. A lot of
Yeah,
people are sleep deprived. And I think it's not a bad idea to switch off the television, sometimes even switch off your phone and just get into a digital detox mode. What is your
agreed.
opinion, Dr. Shetty, on digital detox?
Absolutely,
Because I think one
absolutely.
of the sensory overloads which is happening across the world, and India is very vulnerable, is don't you think that we have such a big geomagnetic field, and I feel the whole geomagnetic field should be switched off, and actually we should get not into just a social isolation and social distancing, but we should also switch off our mobiles, switch off our televisions, and go absolutely on a digital detox for 2 hours every day, and you will be totally free from core anxiety.
I think you're right, and as you said very correctly, that we need to correct the sleep debt, and the digital detox which you shared is absolutely awesome. It will really help us to calm down our sympathetic nervous system, and our hypothalamo pituitary adrenal axis will come back to normal. Agreed, completely agree. But you know what happens, Shashank? That when you see four walls, you feel that the walls are eating you up, and that is a big issue. And I one of my friends said, चारों दीवारें मुझे खाने के लिए आते हैं. तो हमने कहा कि just touch here the wall, find out when did you enter the house, look at the pictures of your housewarming if you have any, and discuss if you want to change the paint of the house. So it's important to go back to the stirred experience of your life and live them across all six senses, and the sixth sense being emotional. So sometimes going back uh, in our life journeys and looking back at our beautiful experiences and our blessings will make us not lonely, but bonded. What do you think? But Shashank, do you see a lot of people giving you calls saying, "Will the virus kill me?" or "What should I do for the virus?"
So I think, there is a fear factor. The fear will kill faster than the virus, because you need to understand that if you stay home, stay put, eat well, be happy, and do exercise, no virus will get you. This virus is not fatal except the vulnerable group. So if you are a
It's a
senior
weak
citizen,
virus. It's a weak
diabetic,
virus.
hypertensive, heart disease, then you are vulnerable. Even in them, the senior citizens, the mortality is only maybe at best 2%. We also don't know whether the virus will go the Thai, Indonesia, Singapore, Hong Kong way in India, or whether it will go the Chinese, Italy, US way in India. We really don't know. But what we need to do is we need to ensure that we are human beings. This virus, if it attacks us, we must build our immunity and become strong. By becoming strong, how do we become strong? We need to ensure that we eat the right food. We need to ensure that we stay healthy by good 7 to 8 hours of sleep. We need to stay healthy by smiling. And we also need to do, apart from all the exercises you suggested, apart from Surya Namaskar, simple skipping or mobility exercises. That will all help. Remember, at one end, the human rights activists are telling us that you please free prisoners who are actually inside prisons. But we actually, by self isolation, are into like a prison like mode. And not
Correct.
many people are there. But Dr. Shetty, as a mental health professional, there are two types of human beings on planet Earth. One are extroverts, one are introverts. Introverts would love it, but the extroverts will feel imprisoned. So, what is your advice? Because we can't give general advice on mental health, and we don't know who is an introvert, who is an extrovert. So, is there a mental health test to find out for doctors like us who is an introvert, who is an extrovert? And is your advice different for extrovert? Is your advice different for introvert?
That's a very intelligent question and a very interesting one. I think what is extremely important is that though we are extroverts or introverts, we need that me time, which is important for both. Extroverted guys may not share all their feelings, though they are extroverted. So it's important to understand that extroverted guys can engage themselves with others through the media, and at the same time they need a lot of quiet time. So sometimes extroverted guys who have been living a fast-paced life, bhag milka singh bhag all the time, they also do extremely well when they do a little yoga, little pranayam, little shavasana, little asanas, or even vipassana or any form of meditation. The extroverted guys also are so tired. My friend Shashank, all the extroverted guys are very extroverted outside their homes, but inside their homes, they're not introverted, but they're just dead silent. So I think if we can convert the silence into an activity wherein they go inside and not outside, it will help them to heal all the wounds which they have faced across time in a globalized world. At the same time, I see you laughing. At the same time, extroverted guys also can really be physical inside the house, and you know how. And at the same time, cuddle with the kids and the family and feel good. They can go in the verandas and talk to themselves, or can put a chair across of a friend whom they want to talk to. So verbal diarrhea may not stop, but this is a great opportunity, not a liability or a curse, for them to go inward and look at themselves how they feel. So I think that's it. But I want to ask you one thing, Shashank. I've been sitting under the sun for half an hour, and I really do not know whether it works. This common sensical ज्ञान कि 25 डिग्री के ऊपर वायरस मर जाता है. So I'll become dark, but I don't think that any virus will die. What do you think?
So, I think there are two things. One is that getting out of an air conditioned environment, because we are living in a concrete jungle, in an air conditioned environment where air is recirculated. So the first thing by sitting out in the sun is you are getting out of an air conditioned recirculated air into fresh air. So
Okay.
from a biological standpoint, that is the first thing to reduce viral load if you have a virus, and ensure that you don't get or harbor a virus, because your body is getting some air which is fresh and is not recirculated. So that is the first thing. Second thing is exposure to UV rays allows your skin to make some vitamin D, builds up your immunity in general, and there is data across the world to show that higher temperatures, viral survival, particularly RNA viruses, survive less. So their survival time or lifespan is shortened. Whether it kills coronavirus, whether it is a cure for coronavirus, the answer to that is no. But it definitely will keep you healthy. It will allow you to be virus free. It will give you some fresh air. It will give you some vitamin D and immunity, and it will also might have an antiviral effect as an adjuvant or as a support therapy. So I think a little bit of sunlight, rising sun or setting sun is very good for vitamin D. They say 2 hours of exposure is required. That may be little too much. And also remember that too much of UV ray exposure can cause skin cancer. But these are some simple things that at least in the Indian population, a little bit of sunlight, getting out of an air conditioned environment might allow us to get fresh air which is not recirculated and might us help our skin to be a little more microbe free.
Shashank, I want to ask you this question. All these guys whom you are now treating for sugar and diabetes, when they're at home, they tend to eat more. In fact, you asked me, I was asking at home if there's anything to eat in the afternoon. You get bored. So when you bored, you just munch. So I asked my family to cut a cucumber and a carrot because you have nothing to do. And you feel like having a vada pav or a bhajia, and you make the family go really mad. I would ask you tips for all those who are at home and were taking any medications for hypertension, diabetes, asthma, or any other illness. How to control their run to the fridge at night and
So,
also in the
so,
day.
so this is an impulse control issue. And
Okay.
when you sit at home, you have two addictions. One addiction is now the new addiction, which
Especially
is seeing
alcohol.
a movie, Netflix, or your phone. That is one addiction. Second addiction is food. And human beings will love food because they get a craving. So the tips which we tell our diabetic patients, hypertensive patients, heart disease patients, and even their family members is chew food, eat slowly, taste it well, have a little of it. So quantum control, portion control. Eat less what is tasty. Don't eat too much and eat frequently. So if you want to have your bhajiyas, have one bhajia. What we tend to do in India is we are extremists. We have too much of it. So if you have a little bit of it for your taste, it is good enough. As it is, you have to ration because remember, this Janta curfew is not going to last for one day. I feel it's going to last for a couple of weeks. It's just a matter of time, and therefore it's important to recognize that we build good eating habits, and therefore it's you have to mentally wire to taste well. Okay, I always tell people taste and feed others. Okay, that's something which we can do. So eat less, control your portion control, and that's about it. You can pretty much eat everything. However, diabetics who have been advised not to have sweets, not to have fried and fast food, not to have nuts except walnuts and almonds, you need to be cautious. Because remember, if your physical activity goes down, you eat too much, you will land up with high diabetes, poor glucose control, you will allow yourself to go under a viral attack. And if COVID hits you, God forbid, then you are into doomsday time. So please don't damage your health by overindulging in too much of food. It is important to taste good food, but ensure that you control the quantity of it.
Okay. Also, Swami Vivekananda said, "Eat less so that you eat more," and he said that you live much longer to eat more, and that was a beautiful quote by Swami. But I have a lot of psychiatrists and psychologists prescribing a lot of mindfulness and yoga. But what I see is suddenly, if you introduce mindfulness and yoga, people are not willing to accept it. And also, Dr. Shashank, I have a lot of NGOs sending a prescription of the timetable for the day. 8 वाजता उठा, त्यानंतर अंघोळ करा, त्यानंतर एकत्र जेवा. I think prescribing something which is very rigid suddenly into the family may not work at all. And I would actually want to know from you. Ideally, I should answer this, but I would actually want to know from you, how do you ask people to unwind when they have 10 days or 15 days with themselves?
So you are absolutely right. Dictatorial enforcement in diet exercise doesn't work. And already people are frustrated. Remember one thing, there is a fear of economic loss. There is one little microbe which is more powerful than any nuclear warhead ever produced. So with the fear factor and with economic loss impending, obviously people are frustrated. They are in no mood to listen to you and me. I don't even know how many people will see Facebook live. Okay, but what is critical and useful is that we tell them simple tips which they can follow rather than telling them 8 o'clock do this, 9 o'clock do this, 9 o'clock do that. I tell them eat on time. Time can be fixed by them. Sleep adequately. Sleep, what time to sleep can be fixed by them. Okay, do at least 10,000 steps a day in your house. Even in a small room, you can do your 10,000 steps. So I think define some do's and don'ts and then ensure that they are enforced upon. Okay, see, Indians are argumentative and they are rebellious by nature. Therefore, when we are trying to do a behavioral change, as you know, you are the mental health expert and mind guru, you need to go to engage them in a positive spirit rather than in the reject mode. I think what is happening is there is an instant reject mode when we give a dictatorial prescription, and therefore engaging them, making them a participant, making them an active participant in their own decision making actually helps them to do it better.
And and I see also, Shashank, I would want to share something. Can you hear me, Shashank?
Yeah, I can hear you.
Okay, I would want to share that there are some parents who are trying to do a lot. I heard about a father who wanted to who was very guilty that he had not spent time with his kid for a long time because of his work. And suddenly he wants to teach physics. He wants to be with him all the time. The son phoned me up and said, please send him back to office. So what happens is when parents have a little more time, the feelings emerge from the deepest crevices of the heart, and they want to show it immediately, instantly, and they expect sons to behave or daughters to behave. So I asked them to go slow and really go slow, so that they actually allow the children to be comfortable. So sometimes overcompensating for what you have not done can harm the entire relationship. And these 10 standard boys and girls are in good shit because all the fathers believe that आत्ता संपूर्ण portion complete केलं पाहिजे. We should complete the portion in 2 months' time, and there's an opportunity. So mothers have ganged up to through the lives of the kids, and the kids are absolutely in a state of distress. There was one boy who said, "I want to listen to EDM." Other girl said, "I want to listen to BTS," and I didn't understand anything, but I pretended I understood. They want to laze, they want to really enjoy music, they want to be, they want to speak to friends, they want to jump, they want to laugh, and they want to enjoy the stay with their parents. On the other hand, the parents are becoming like, I think, Putin, very dictatorial and authoritarian.
I think, I think you are the mind guru. I completely agree with what you're saying that we cannot become and have tiger dads and tiger moms. I thought
Correct.
that formal phase was only for tiger moms, but suddenly because of the social isolation, you will get tiger dads emerging, and they
Yeah.
will be conflict at home, and conflicts at home will be all mental health conflicts. So therefore, we need to have a minister of loneliness and happiness, which
I've
someone
written
like
to
you
the PM. I've written to the PM that mental health
government
minister is a
and should
must.
have a minister of mental health because in such situations which are extraordinary and exceptional situations there is going to be a huge amount of home conflict in concrete jungles, and we are in a concretized world. This will not happen in a village, but this will definitely happen in small apartments because we have got into a concrete jungle. These are side effects of concrete jungleization. And I think the second
Absolutely, absolutely.
and the second thing which you said very correctly is the children want their freedom. Anything which is restrictive, which restrains, will take away their freedom. And if you take away physical freedom, which we have already done by this social distancing, if you also take away their mental freedom, this will be a double whammy. You will actually see violence at home, and you will also see a lot of suicides. So, what is your opinion on this? I feel genuinely there is a mental health risk, and I was told that domestic violence as well as suicide rates in China have gone up. What is your opinion on this?
Yeah, and also divorces have gone up on China. I think we are trying to uh, give the family heaven uh, from hell. In the sense, hell means traveling in train, working long hours, and suddenly they see the heaven inside the house. They have a lot of time, and kids are running inside. They want space. I completely agree that loneliness can actually lead to changes in the brain, and it might cause depression. And there are five ways of beating it. Number one is bond, but don't overbond. Give space to the kids inside your house. Like I saw a young girl wanting to talk to her boyfriend, 15-year-old girl, and the parents found it that this is a chance to ground her. And she said, to help with all this, I'm running away. I want to go and meet him. I don't care for your exams and I don't care for you. The father, in panic, just phoned me up. And I said, allow her to talk as long as she wants. And if you allow her to talk as long as she wants, she'll have enough time for you also. When she shares her affection at the age of 15 with a guy whom she loves, she will also share her affection with you. But if you stop her, she's going to rebel because of the age, and it is the desire which you are breaking. So be pragmatic. She is not murdered somebody. She's just chatting and she's just talking. So once she spends a lot of time inside her room, she'll come back from the room and she will then be comfortable to talk to you. You might not accept that love, but acknowledge your feelings and find a way by which you can re communicate, re-establish, and your daughter. So I agree with you that too much proximity is also boring. But India is a land where we have faced so many struggles. But we need to be cautious, fighting, share your feelings, give space inside the house, though you're all together. Don't impose activities on the family. Let each do their own things. At the same time, do things together. Don't impose prayer, yoga, do board games on the children. They'll play only when they feel like. But just look back and look at your mood lifters and your mood shifters. If you have been singing as a child and not a great singer, stop singing. If you feel that you have been doing a dance, put the music on in a room and start dancing. No harm at all. And what is very important is that provide space, don't encroach. But kids also understand that under 18, your space can be violated by your parents because the flat is owned by your parents. No locks behind closed doors under 18, you can knock and enter. So be creative, engage, give space, and be connected. Use the social media to be with your friends, your relatives, your favorite uncles, aunties, and your teachers. But those who are mentally ill, Shashank, they need to be very careful. Those who are already taking medications for mental illness, they need to speak to their doctor. They need to actually adjust their dosages. And if they lose their sleep, they feel very anxious. The heart is racing. If they started washing their hands multiple times, I'm worried that people with obsessive compulsive disorders might excessively wash. It's important to have that one call over phone or over WhatsApp to actually let them know that they are probably going over the trend and see that their behavioral boundaries are maintained, medications are adjusted, and psychiatrists should be accessible and available on the phone as much as family doctors and clinicians like you.
So I think what you say makes a lot of sense, and we need a lot of control. This reminds me of a famous researcher from the Mayo Clinic, Professor James Andrew Levine. He propagated a concept called NEAT, non-exercise activity thermogenesis.
Oh,
So
that's good.
when you are stationary, you should be fidgety. See, the biggest problem is we are going to be all now holed up at homes. But if you are going to be holed up at homes, and if you are going to be sthita prajna and sleeping without moving, that is very dangerous. So what should be is you should be fidgety. Now most people get irritated when the individual is fidgety. Right now also, if you see me, I'm very fidgety as an individual, and that is why maybe I'm lean in my body mass. So if you really want to prevent obesity, prevent diabetes from happening because of this covidization of the globe or covidization of Mumbai or India, what we need to do is promote fidgetiness, promote a little bit of physical activity, and remember, simple tips don't demand efforts. The best ideas are born from adverse situations. Please do not look at this as an adversity. Look at this as an opportunity for better health, better communication, better bonding, and actually better way to happiness. I feel this is like a forced vipassana at home. And therefore, people who really want to do mindfulness, it's a good opportunity. People who want to engage in their hobbies like reading books or doing research on internet, it's a very good opportunity. People who want to play bridge, carom or chess, it's a good opportunity. So it is like a forced holiday or a vacation. Look at it with happiness and not with stress and unhappiness. I think if that attitude we have, we probably will be able to handle this better.
And I would want to ask you, Dr. Shashank, how do you handle yourself?
No, I don't think I'm able to handle myself. I think it's important. I have started doing meditation and yoga for a good 45 minutes every day in the morning, and that is definitely helped. I have tried and attempted to sleep better and eat on time and eat appropriate healthy food. I think that is helping me better. And I definitely have got into a digital detox much before COVID started for an hour and a half every day, and it definitely has helped me because this sensory overload, whether it is visual or non-visual, definitely allows you to handle yourself better. So you feel more confident of handling yourself. It slows down your pace, and I would personally feel that if people want to stay healthy, they should eat less, they should eat slowly, they should eat on time, they should ensure that they do their 10,000 steps every day, even if they are homebound. They should try to ensure that they sleep on time and sleep for a good 7 to 8 hours. They must stay happy. They must smile. They should avoid all addictions, whether it is smoking or alcohol. The other fear is people will sit at home. They will binge food. They may have alcohol or they may smoke. And all these factors will kill more human beings than
Then the
any
virus.
COVID virus. And these are our genuine fears. So it's important for us to recognize that we do not indulge into inappropriate behavior, which is a health hazard. And that's very important to recognize.
Absolutely, I think these are positive. In fact, few of my friends asked me if they can take a 60 with thumbs up. I said absolutely no. When you was young, when you are in school, you never required 60 to dance or to laugh. But now, when you are in your 40s, you need 60 to dance and laugh. I told them no. And as far as I'm concerned, for me, blogging is very relaxing. I wrote a blog on sensory overload just yesterday, and I'm going to write a blog on the four walls are eating me, and it gives me a lot of time to introspect and understand myself much better. But what is also important, Shasha, is that a lot of people in the slums, Uh, though honestly, slums have more activities than people staying in towers. There's more emotional interaction. In fact, Shashank, in towers, the emotional contact time has gone down. The family contact time has gone down. Though in slums, the space is small, the risk of the virus is higher. There is Shejar, क्या नाम था तुम्हारा कुछ? Shejar?
Shejari.
uh,
Shejari
say,
means neighbor.
dharma कहते हैं ना, the neighborhood is alive in slums. But how do you think they should cope with little space if they're taking medicines for for other illnesses? And how do they handle their nutrition? That's a very big challenge.
So I think those are both very good questions. First thing is ensure that you have adequate stocks of your medications. There are very good home monitoring devices for diseases like blood pressure and diabetes. You can easily buy a good home BP and glucose monitoring machine. Then you need to ensure that you adhere to lifestyle better, because this is a very good opportunity to improve your health rather than worsen your health. So I think for all the people who have some problem at home or challenges at home, we need to ensure that we need to get the right things at home and take care. Also, we can take advice digitally, but don't allow a Google or a WhatsApp to get you in order. See, unfortunately, this WhatsApp university
I can't
has
hear you. You are away from your.
no. I'm quite away. Can you hear me now?
Yes, yes.
Can you hear me now?
Yeah. You have to be closer to your router.
Okay. Sorry, Dr. Shetty. There was some. I am self isolated at home as of today, and therefore I
Absolutely.
have to do some small little chores as I
Yeah.
talk to you. And I think self isolation is not an easy task. Living in four walls is not at all an easy task. And living, with when you have a disease at home, actually increases anxiety. And therefore, we have to ensure that all the people who have anxiety, they have to ensure that they need to connect with a mind guru like you. But if they have diseases like blood pressure, diabetes, or any other disease, okay, they stock up their medicines, they have their medicines on time with appropriate lifestyle. But all this will not help if they are not positive or happy. If they live it with a zone of fear, with a zone of uncertainty, कल क्या होगा, मेरे को कल का पगार मिलेगा क्या? You see the type of questions I am getting. Okay, डॉक्टर साहब मेरा इंसुलिन नहीं है मेरे पास. Okay, मेरे पास मेरा टैबलेट नहीं है. I don't know whether I will continue in my job tomorrow. Okay, these type of economic and health anxieties are corrupting the mind and getting negativity. It will actually lower immunity, and if it lowers immunity, it will be very counterproductive. And therefore, it is important that people at large realize that despite of all their adversity, they need to be cheerful and happy. I'm happy that the Prime Minister, as a sensitizing measure, started this so-called Janta curfew for a day and is allowing and preparing India at large so that we can handle, this type of curfews better. This is actually, he has been guided by mind gurus like you, where he is able to get the nation home quarantine, and after the pilot exercise, probably he is going to go for a long-term exercise. So I think this is something which has been done. Let us see how Janta curfew is there today. I'm sure the only beneficiaries of this is the digital world. There is a digital explosion. It has made people who never were going on Facebook. I had completely got off Facebook, but you have forced me to come back on it. Okay, I have never gone in my life on Twitter, but because of Dr. Harish Shetty, I'm back on Twitter. Okay, I'm not back. Actually, I've started Twitter for the first time in my life. So obviously, there's always a first time for everything, and I'm sure that people will definitely look at the positive side. There are always two sides of coins. I think there are people who are born negative will think negative. For them, it's an opportunity to see the other side of the coin. And people who are happy, they should not become complacent. They should get a little guarded and careful. So I think this is a good. I think this is like a blessing in disguise. I think we should enjoy it. It's not all about going out, making money, being, getting a ego satisfied. It is a good opportunity for us to be you know be happy.
I think this entire experience will help people to understand that एक मच्छर एक virus इंसान को, you know what, it is really almost an existential question to the human race, that whatever the human race might try to become more powerful through money or through arms, uh, nature always has its last laugh. So as we slowly close, Shashank, I would like to share a few tips with our family. All those who are mentally ill, to ask their psychiatrist to talk to the chemist so that they can get the medicine with a soft copy of the prescription, because the government of India has not passed any notices like the UK government, which has passed the coronavirus notice. At the same time, I would ask all my patients to see that they take the medicine, they keep in touch with the doctors, and all the families who have watched this video, stay indoors. It's a disaster. Save the country and save yourself by being close to your family members. Look at this as an opportunity and as something where your children will learn, and they will share these stories to their own children and their grandchildren later. You're writing new softwares in the minds of the children, and be mindful and be yourself. What do you have to say, Shashank, as we slowly close?
No, I think I agree with you. Stock your medicines. Don't go panic buying. Don't buy too many masks and sanitizers. Don't ensure that you get sanitizer poisoning because of alcohol or the soap. Okay, simple hand washing is good enough. So let me conclude with the virus. I think whatever you said is absolutely correct. This is a small COVID-19 virus. It is very easily killed by good hand washing. There are 7-step technique of hand washing which has to be done either with soap or alcohol based sanitizer. That is number one. Number two, any surface you contact, and the commonest surface you contact is the door knob, opening, closing, whether it is of the door of your house, door of your shop or establishment where you are going, or the door of your car, that needs to be cleaned. Surface contact, so any surface, see, we have to go for a no touch contact, a no touch policy. If you are able to avoid that, and if anybody is sneezing or coughing, using the elbow technique, not necessarily every time everybody will have a mask, and masks are in short supply. The easiest way to have a mask is to make a mask of a cloth which we can actually attach and put it in boiled water, and the boiling has to be done for an hour, and just dip it in boiled water, wash it clean every day is good enough. You don't have to panic buy a mask every time. So if you do simple things, we can tackle this microbe and stay home. Okay, don't be foolhardy. Don't try to go and get into contacts. Also, it's important to recognize that if somebody is suspected in your building, or somebody has come from out of India, now of course that has also stopped because of Mr. Modi. Do not ostracize or stigmatize these people. They are human beings. Yesterday, the talk of the town was what? That one singer did, was very casual and did not do self correction. She needs to urgently see a psychiatrist because she has been trolled. She has been put into a lot of negativity, and maybe she did not understand the implication of what she was doing. Okay, and it's time to move into a virtual prescription, e-pharmacy and e-prescription. Also, I will urge that our parliament should meet virtually and into virtual offices. I'm sure that virtual e-consultation may be permitted. And as I talk to you, there is an endocrine community group by my friend Shaktivel, who you know. He is
Yes,
trying to,
Chennai, Chennai.
the Endocrine Society of India can have a e-virtual consultation because of the extraordinary circumstance, at least for follow-up patients. Can we help them electronically? Because currently the law of the land is not in the favor of an electronic consultation. but people will be under distress, and we do not want to put it as a health hazard. The second thing is right information. We have an information overload. The study that talk among the medical communities, should we all be talking azithromycin and chloroquine, and is that the cure? By the time the medical community reached to the chemist, because of Dr. Google and Dr. WhatsApp, already the stocks of chloroquine are over. So people who need it won't get it. See, this is type of mob hysteria has to be contained. We don't have to get hysterical. We don't have to get panicky. World is not going to end. There is no Nostradamus here. China has already overcome the epidemic. Korea and has already overcome the epidemic. Look at Thailand and Singapore and Hong Kong. The epidemic did not even occur there. All they did is quietly, chup chap, shut their country, wash their hands appropriately, kept their surfaces clean. If you wash your surrounding surfaces clean, if you keep your body clean, if you take a bath every time you go out, which is a traditional tradition in India, you will be virus free. You don't have to get into a paranoia. You are going to get a forced vacation maybe for 2 to 6 weeks, and then life is going to be back to normal again. So that is my tip for it.
I think I'm also equally optimistic that our patients, our people will respond and rise to the occasion. And for all the viewers, let me tell you that me and Shashank will come back to you after a week, both on Twitter and on Facebook. And both on behalf of Shashank and myself, I thank Anirudh Sapatnekar for really organizing this for us, doing all the background work and laying this space for us to actually interact with all of you. Thank you, Shashank. I thank myself to be here, and I thank all the viewers for their patient
Thank you.
listening.
Thank you, Mind Guru Shetty.
Thank you. Thank you.